This is a series of my educational video series called Your Question, My Answer. So, this individual had shared some lab information. I'm going to go over that. Iron level is 44, which is low. Ferritin level is 10.5, which is low. A1C is 6.1, which is definitely in pre-diabetes range. Patient doesn't have history of diabetes. Complete blood count, hemoglobin is 11.3, hematocrit is 34.4, which is a lower end of normal range. MCV, mean corpuscular volume, is 70.5, which is in lower end, which is basically low. MCH is 23.2, which is low. Platelet count is 289, which is pretty good. MPV is 7.8, and comprehensive metabolic panel seems to be okay. There is ultrasound report shows uterine fibroid uterus, and blood pressure 130 over 80, 131 over 70, heart rate 68, BMI 33, height 5'5", weight 198. So BMI is 33. Patient is taking medicine for blood pressure and was taking iron supplement in the past, but not anymore. So overall impression, as you can see, that patient has iron deficiency anemia, has pre-diabetes, and has weight issue with obesity, and has uterine fibroid. And this combination, they fit together clinically, because fibroids can cause heavy period, which that this person has, that will lead to iron loss and low ferritin and microcytic anemia, and A1C is also in pre-diabetes range. So your lab supports iron deficiency anemia. Microcytic, we call this microcytic hypochromic pattern, a classic for iron deficiency anemia. And this is very consistent with iron deficiency. In a menstruating woman, heavy menstrual bleeding from fibroid is a major possible cause, and oral iron treatment is the first line therapy. It will take months to deplete iron, up to 6 months. And I would suggest that you should also see GYN because of uterine fibroid. It's about 4.5 centimeter in size, exophytic. Um, uh, and find out whether you need treatment for your fibroid or not. Because treatment is always recommended for fibroid uterus, because they cause heavy, painful period, anemia, and it disrupts your daily life for a week at least. And then anemia, of course, they make you tired and less energetic. Other thing concerning is pre-diabetes and your weight issue. A1C 6.1%, definitely pre-diabetic range. BMI is 33. So I think that weight loss and lifestyle treatment are the foundation, and diabetes prevention is very important. I think that I would suggest considering metformin, if because that's going to help you to lower your insulin resistance. At the same time, you need to adopt healthy lifestyle. Okay, and that would definitely help you. When you take iron, take it with a vitamin C or orange juice, and avoid taking it with calcium and antacid or tea, coffee, or dairy for at least few hours or on the dose. And repeat the labs of CBC, ferritin, iron study in 3 months, and that should help you. And follow with the GYN. I would say there are different options. Surgery is one option, but some oral contraceptive pill, progestin therapy, and different kind of IUD can be helpful as well. But surgery is there. A surgical option is there. Myomectomy, uterine artery embolization, and in some cases hysterectomy as well. Um, and you should, as far the weight is concerned, you should reduce sugary drinks, sweets, refined flour, ultra processed food. You should favor protein forward meals, vegetables, legume, high fiber carb in small portions, and practical plate method is half of the plate should be non-starchy vegetable, 1/4 should be protein, and 1/4 should be high fiber starch. Your goal should be to lose 5 to 10%. Walk, some kind of aerobic exercise, 150 minutes per week, and 2 days of resistance training in gym would be great. And limit your salt, sleep better, and follow up with your doctor. I think with all these changes, you are looking for great improvement in your health. And if you have any follow-up question, you can always contact. We can talk about it again later. Thank you for watching.